Thank you for listening to this important message. There has been a lot of information sent out to you regarding COVID-19. I would like to talk specifically about your outbreak management plan and some updates and changes you may need to make in regards to COVID-19. Today's objectives: we will be discussing prevention measures to take, how to recognize early indications of a possible outbreak, initiating containment strategies, and notifying appropriate parties. You have prepared for and mitigated outbreaks of influenza and norovirus in the past. What do you need to do to your plan to update and change? You do not need to reinvent the wheel. Start by making sure that your contact numbers are up to date for your local health department, your state health department, and other consultants and resources. Before an outbreak, education is very important. Having the most recent information will minimize some of the stress felt by your staff, residents, family, and their representatives. What is the process used when your staff is ill? Who do they call? Do they know when not to come into work and how long to stay out? Review your infection control practices. There is an increased focus by surveyors on infection control practices, as this is the best line of defense to minimize the spread of illness through your facility. You likely have signage at your entrances, including the message not to visit if ill. But signs can become invisible when you walk past them every day. It is time for new signage. Emphasize hand hygiene and cough etiquette by your residents, visitors, and staff. What are your audits of your staff hand hygiene showing? Are staff comfortable reminding their coworkers when necessary? Is re-education needed? Are your supplies stocked and readily accessible? There have been reports of shortages. How are you addressing these? In addition to signage, you should be screening visitors for signs of respiratory infection. One suggestion has come from public health to route your visitors through one main entrance where they can be screened for symptoms of respiratory infection, travel history, and possible contact with a suspect or confirmed case prior to their arrival at your facility. As part of your new resident admission process, you should also be screening for symptoms of respiratory infection, travel history, and possible contact with suspected persons. Regardless of the cause of an outbreak, there are three main steps that need to be addressed, really all at the same time. You need to recognize the illness, contain it and prevent its spread, as well as notifying all appropriate persons. We're going to be discussing each of these today. How quickly can you recognize the first signs of illness before it spreads through your facility? In your facility, this must happen 24/7 and is the responsibility of all staff. Identify a lead person or persons to monitor the massive amounts of information that is being sent to you. Two of the best websites are from the CDC, the first being specific to long-term care, and also their general information website. State-specific information can also be found on your public health website. Early recognition of symptoms is so important to minimize the spread of illness. Every time your staff has an interaction with a resident, they should be on the alert for signs of respiratory infection. Your staff also needs to be thinking about these symptoms that may indicate illness in themselves as well. Again, contact your local health department if there is any suspicion of illness. They have access to resources and can assist you. Usually in the case of an outbreak, we are looking for an increase of illness above baseline. But in the case of a novel organism such as COVID-19, one suspect case is cause for action. What are the symptoms you should be looking for that may indicate COVID-19? Symptoms may include fever, cough, shortness of breath, and/or sore throat. These are very general symptoms that you see with many respiratory illnesses, but they are the trigger that should spark an evaluation. Have they traveled to an area of illness or been exposed to community spread? Once you recognize that you may be experiencing an outbreak, the next step is to contain the spread as much as possible within your facility. Again, work with your local health department. They will assist you. The type of transmission-based precautions indicated for COVID-19 is standard precautions plus contact and droplet. Post the appropriate signage outside of the resident room. The personal protective equipment indicated includes gowns, gloves, face mask, and eye protection. Be sure that you have adequate supplies readily available and that there is a trash can near the resident room exit for easy disposal of PPE. CDC currently states that facilities without an airborne infection isolation room are not required to transfer the resident as long as the resident does not require a higher level of care and that the facility can adhere to recommended infection prevention and control practices. Your facility is a unique setting as it is the resident's home as well as a healthcare facility. Your local health department can assist you in deciding how your daily activities need to change, such as limiting group activities or limiting new admissions. They can also help to arrange for transfer of a resident to a higher level of care when that's indicated, working with your EMS and also the receiving facility. Also, your ombudsman is a great resource. One bright note is that the COVID-19 virus is not hard to kill. A hospital-grade disinfectant with a kill claim for human coronavirus should be used. As in any outbreak situation, ramp up the frequency of cleaning and disinfection of any equipment that goes from room to room, all your common areas and high-touch areas, as well as your staff workstations. For your staff, even though you have provided education regarding your preparations of COVID-19, once you have a suspect case, you will need to repeat this information as well as any new information and changes required. Utilize consistent staff assignments if possible, review your staff illness policies, and reminding staff that they must exclude themselves from resident care at the onset of symptoms. You have recognized a possible case in your facility and started the process to contain the spread. You've already notified local public health. Who else do you need to notify? While each facility is unique, this is a start of a list. Contact your medical director and other key personnel, all care providers for your residents, sister or adjacent facilities that may share staff, contracted ancillary services, all your staff including dietary, housekeeping, maintenance, laundry, etc., any referral facilities that you work with. Be sure to document notification of all parties to prevent confusion and possibly missing someone. You will need to update your residents and their families and representatives in regard to the current situation and the additional actions that are being taken. Let them know that you are working with public health and doing everything possible to minimize the spread of infection. Also let them know what their role will be, what will change for them. Change can be upsetting to your residents. Try and keep explanations as simple as possible. Throughout this recording, you have heard two messages repeated. One is that you do have an outbreak management plan that has been used to work through other outbreaks. It may need to be updated in regards to COVID-19, but you are not starting from scratch and resources are available. Number two, utilize your local health department. They will guide your response to any suspect or confirmed cases and utilize all resources available to you. Thank you for listening to this important message. Please reach out to your contact person at Superior Health Quality Alliance for more information.